So every procedure comes with its own set of risk, benefits, and alternatives, and breast augmentation is no different. I do think it's important to understand the risks of any procedure you're about to undergo, and so I want to talk about that here. The primary risk of a breast augmentation, in my opinion, is a risk of a mild asymmetry. Now, one of the things I constantly tell my patients is that when we're augmenting the breast, we are making everything larger. And that means that some of the things that may seem like very minor differences at baseline can become more apparent once the breast is augmented or larger. So, a small difference, for example, in nipple height or nipple position can be exacerbated by placing breast implants either above or below the muscle. Now, some of these risks of asymmetry can be mitigated, for example, with a breast lift, and your surgeon may recommend that on one or both sides. But it's important to note that not everything warrants a breast lift or other corrective procedures. All breasts are very mildly asymmetric at baseline, and some breasts have a fair degree of asymmetry. Even slightly asymmetric breasts can look very normal and natural, so you don't always need a corrective procedure. Other risks in general are very low. For example, the risk of bleeding, or what we would call a hematoma, is very low but very real. We are lifting up the muscle. Typically, when we're doing a breast augmentation, the muscle is very vascular and you can have a bleed either that same day or in a delayed fashion. Your surgeon will likely recommend going back for a very short surgery where we evacuate the blood and return your breast to a normal size. You will notice if you do develop a hematoma that one breast is larger, firmer, and tighter than the other breast, and typically more painful. Even though this is very common to have a very mild degree of asymmetry and slightly firmer breast at baseline, you will definitely notice if you have a hematoma due to the degree of asymmetry and typically the pain associated with it. Again, while it's still very rare, it is a risk that can happen. Nerve injury, damage to other structures, and other severe complications are very rare in breast augmentation, and the same thing is true for the risk of infection. While these are typical things to worry about, well, when getting surgery of any kind, they're typically very, very low in breast augmentation. While nerve injury is uncommon, it is relatively common to have some degree of sensation change in either the nipple or the lower pole of the breast. This will return to normal in the vast majority of women, upwards of about 90%, but it will take about 3 to 6 months. There are some patients, a very low percentage, who may lose sensation across the nipple or lower pole of breast permanently. Again, breast augmentation in general is a very high satisfaction and a very low risk procedure, but it is important to note some of these risks when moving forward. I hope you found this video helpful, and if you do, check out some of our other videos on breast augmentation and our other procedures.